Hello, everyone. If you guys have been following my channel for a long time, back in January, I made a couple of videos about this thing called the SIREN study. It was a study out of the UK where they enrolled all of their healthcare workers, and then they were checking them every 2 weeks and testing them every 2 weeks, whether they were symptomatic or not, to see if they had COVID. And they published two papers back in May, and somehow I missed these, so I'm going to talk about them now. I was pretty excited about this study because it had a lot of numbers, like 20, 30,000 people were enrolled, so they have big numbers, so it's very robust data. And it's going to help answer a few questions that we had at that time. Now, this data doesn't cover the Delta variant, so it's talking about the Alpha variant, which was common at that time. But I'm going to talk about the first of the studies today in this video, and then the second paper that they published will be in a separate video because it answers a separate question. So this question that they answer in this paper is, does previous infection with COVID protect you against reinfection? So how common is reinfection? It can happen, obviously, but does it protect you pretty well or not well at all? Okay, so let's read through the summary, and then that'll give you kind of the answer. And then if you want to stick around for the nuts and bolts of the study, you can stick around for the rest of the video. Okay. So they're talking about the methods. So basically, they enrolled healthcare workers and support staff and administrative staff working in hospitals starting around December of 2020. And then they tested them for antibodies. And then if they were antibody positive, they assumed that you had previous COVID because this was before the vaccines were available. So this is a test amongst the healthcare workers in the UK before the vaccines were available. And so if you had antibodies, they were like, you probably had COVID before. So this is an important thing. Basically, this paper looks at people that had antibodies and then people who didn't have antibodies. There are a few people that were infected and never created antibodies. So those people would have not been in the antibody positive group. So what this paper really answers isn't, does previous infection protect you against future COVID? What it answers is, does previous infection with COVID where you generated an antibody response protect you from future COVID? And most people that have had COVID do generate an antibody response. So they are kind of the same group, but it's not exactly the same group. All right, so findings. From June to December, they enrolled 30,000 participants, 5,000 were excluded, and they looked at 25,000 people. And what did they find out? They found out that the adjusted infection risk was 0.159. So what that means is about 84% protective. Yep, so previous history of SARS-CoV-2 infection was associated with an 84% lower risk of infection. And this means all infection, not symptomatic infection, because they were testing people whether or not they were symptomatic. So this means it was associated with 84% protection against both symptomatic and asymptomatic infection. So that's a little bit different than the vaccine trials that were done, which only tested for symptomatic infection. So when the vaccine trials released their results, we weren't sure, does the vaccine protect you only against symptomatic infection or also against asymptomatic infection? This study says that if you had previous COVID where you generated antibodies, you were 84% protected against both symptomatic and asymptomatic infection. That's a pretty high percentage because remember the original vaccine study said like 90 to 95%. So 84% with symptomatic and asymptomatic infection is very good protection actually. All right, so that's the bottom line of the study. If you want to stick around for the nitty-gritty, we're carrying on. Okay, so I just basically like to look at the tables, and the tables are kind of interesting. So there's just some interesting data that they don't talk about that you can kind of glean from looking at the tables. It's not really super relevant information, but just kind of interesting facts. And so here's the demographics of the study participants. So these are the people that had, when they enrolled them in the study, they had positive antibody tests. So that means they had previous COVID where they generated antibody response in the negative cohort. And they split it up by various categories. So here's what you look at. Here's what percentage of all the participants were female. So mostly female in this cohort. And the positive cohort is less than its representation. That means in this group, women were less likely to have been previously infected, and men, who were 15.6% of all participants but had 17.2% of the positive cohort, they're more likely. So for some reason, men were a little more likely than women to have had previous COVID. And then in terms of ethnicity, looks like white people were a little bit less likely than average because their positive percentage is less than their total representation, whereas mixed race and Asians and Chinese, I don't know why they separated out Chinese from Asians, but those groups were more likely than their representation. So they're a little more likely to have been previously infected. So they have a little bit higher rate of previous infection. You can see for black people, they're about the same, 1.6, 1.6. Medical conditions didn't seem to make a huge difference. Okay, so this is kind of interesting. What group of healthcare workers were they? So nursing or healthcare assistants, they were more likely than their representation. And administrative assistants, less likely. Doctors, more likely. This kind of makes sense because doctors and nurses are interacting with patients, and they're more likely to be exposed, so they were getting infected a little bit more. So that makes sense. And then patient-facing role, yes. So if they were patient-facing role, they were a little bit more likely, which makes sense. And then index of multiple deprivation, this 1 is the poorest, 5 is the richest. So looks like if you're poorer, you're more likely to be infected. And that's something that we've seen in many studies before, is that poorer people are more likely to get COVID, probably because poorer people tend to live with large families because they have to share rent, and they're around other people more, and they just don't have the ability to social distance as well as wealthier people. Like they have to take public transit, they don't have their own car, they don't have their own house, they have to share their house with extended family or friends maybe. So that makes sense. Okay, so yeah, that was the interesting things that I gleaned by looking over this study. But the take-home point basically is, if you had previous COVID and you generated an antibody response, which is the vast majority of people, then you are 84% protected from both asymptomatic and symptomatic disease. And the other caveat to this was this study was run during the early part of this year and the later part of 2020, and that's when the Alpha variant was common in the UK. The Delta was not, didn't even exist at that time. So we don't know how this data holds up under the Delta variant. If I were to guess, it's probably less protective against the Delta variant. But I'm not aware of any great data right now, at least to this level. There's a lot of kind of less good studies with smaller numbers that suggest that. But it's very hard to run studies that are prospective of 25,000 people, and they did that. So when you run studies that big, you can be pretty sure of your results. So what we can say is, under the Alpha variant, this is the case. You're very well protected if you had previous infection with a positive antibody test.